Hello, everyone. This is Christopher Mick at the Hudson Area Public Library, and I'm joined today by Dr. Paul McGinnis. We just wanted to do an update since the earlier kind of long format conversation with Dr. McGinnis and our library director, Shelley Tugas, had. There's been a lot of information and kind of ups and downs and changes since that interview, and so we thought it would be a good time to do a kind of update and ask a few pertinent questions that have come up in recent weeks. And so I'm going to introduce Dr. McGinnis here and get right to the questions. So Dr. McGinnis, again, thank you for making the time for us today and getting right to the questions that we had. The first one was, how will we know when we've passed the peak of Omicron? There's been a lot of talk of case rates and the numbers and a little confusion as to, are we at the peak now? Has that already happened? If we passed it, where are we at with things?
Yeah. Hey, thanks for the opportunity to comment again and talk. It's been a little while since Shelley and I had the conversation last fall, and things have changed. Then we were dealing with Delta, now we're dealing with Omicron. Same virus, but slightly different traits and characteristics. So how do we know that the peak is past? Well, I think it has actually for Hudson. So if you pull up that first graph I sent you,
this
is from Chris. This is a case rate graph, and it's over time. And I find this one particularly helpful in answering the question that you asked. And this is the data from the county infogram site. There we go. So if you look at this, this is actually from the whole time. This is when the pandemic started to very now. So if you see that first big bump that happened in November of last year, that was the Alpha variant or the Wuhan variant. If you look further on down, you see that rise, you see that really flat spot in June and July, which was amazing. Everybody was pretty excited about that. Then you get this slow climb that starts in August and then really accelerates when the kids went back to school. And unfortunately, without masking, I think that contributed to that rise. And the county epidemiologist also feels the same way. So then we look at what happened in January. That's when, so November, August through November is really pretty much Delta. But then we get this really sharp spike right at the end here, and that's Omicron. And Omicron just tore through our community, made a lot of people positive, and a lot of people have some modest illnesses. It did contribute to some hospitalizations, but not nearly as much as I think everyone was concerned. So that was really good news. But then you see the far right side of that graph, and that line is coming down pretty precipitously. And actually, I had a brief conversation with our county epidemiologist this morning, who indicates that the current case number is about 59 per 100,000 over the 7-day average. So it continues to drop. So if you see on the slide, it's actually running around 100. That's from last week. As you go to this morning, and there's usually a little bit of a dip after the weekend because there aren't as many test results back yet. So that is still moving in a really good direction. So that's the first thing. The second thing we look at is case positivity rate. So the percent positive, that's coming down slowly. I think that number right now is a little suspect because there's so many at-home tests. So the case positivity rate, I think, is somewhat underestimating where we really are. I think it also just is not as reliable a data point. But if that's coming down, that's a good sign. It means that there's plenty of testing and there's a little less virus in the community. It's still high. And I want to be clear on the overall case rate. It's still really high. If you look, it is still as high as and very close to many of the times where we've had the maximal surges of the original variant and of this Delta variant. So we're not out of the woods yet, but we're starting to see some light through the trees. So let's be clear about that. Still in forest.
Sure.
If you go to the next slide, this talks about this is another way that's being utilized quite a bit. And this is wastewater treatment. Facilities monitor the wastewater and monitor the number of virus particles in the wastewater. And Hudson's been doing this actually for quite a while as part of this. And that's been extremely helpful in terms of predicting this. So if you look again to the far on the right side of the chart here, the top chart, you see the graph over time, and you look at 10 and then 100 and then 1,000. So this is a logarithmic scale. It just doesn't go up by tens, it goes up logarithmically. And you find that there's a slight downturn towards the far right side of that screen. So, but we're still at over 100 million copies of the virus in our wastewater in Hudson per person. So based on the detection rate. So there's still a lot of virus in our community, but it's starting to trend down. That's a good thing. You can see the middle graphic at the very top where it says there's a moderate decrease And we'll see how that trends over time, but that's really good news as well. The important thing too is if you notice again, the far left side of that slide, of that graph, was back in July. We're down to 10 copies per million, as opposed to the well over 100 that we are at the present time. So that, again, good information, just gives you an idea of what's out there and how much it's involving the population directly in Hudson. So when I look at all three of those things, I think we're past the peak. I think we're coming down. We can see the light through the trees. We're still in the forest.
Got it. Question number 2 we had was about St. Croix's vaccination rate. Seems to have barely moved in recent months. We're at about 59% at the time that the question was written here. Thoughts about why we can't move the needle on that?
Yeah. So why don't you bring up that next slide that I sent out to you, the one on the vaccination rate. And again, this is from the county database. The wastewater slide, just to be specific, is from DHS. That's state data, and that's where I found that one. So this is the county vaccination rate as of the end of last week. And so, yeah, you're right. It's stuck at about 60%. Now, part of that is going to be the kids under 5 who can't get vaccinated. But I think that the answer to your question. So first off, if we look at our over 65 population, the vaccination rates there are actually pretty decent. Mm-hmm. Now, in some counties in Wisconsin and elsewhere in the country and in the world, those numbers will be up above 95, 98, 99%. So pretty high. What we really see is we see this big chunk in the middle where we get these 50s, 60s in those population of the teenagers up through kind of our middle-aged adults up through the 44, 45-year-old category. And I think that there's several factors. And then we get the 5 to 11-year-olds. And I think that represents that a lot of parents haven't quite decided that this is a good thing for their kids. I think there's 3 big factors that are contributing to this. First off, simply there's a lot of misinformation that's been out there. And frankly, I think many of it is, in my opinion, lies. People know that they're spreading information that's not true. They know it's not true, and they continue to spread it. And then other people just are choosing to spread stuff that's not right. And there's been good data and good evidence that have accumulated over the past 2 years that what they're saying isn't correct. The vaccines work. They work really, really well. They're very safe. There's no question about that. All the medical providers, with the few exceptions out there, are in agreement with that, and those exceptions are frankly wrong. And so I think there's a lot of misinformation. I think the second thing is that there's been a set of assumptions that have been pushed to people that, one, if you're younger, this isn't that bad. And if you get the vaccine, where the medical community is just lying to you and it's actually much more risky than it really seems. And I think both of those are incorrect profoundly. So while you are less likely if you're younger to get ill, you certainly can get ill. So take the example of a seatbelt. If you're not wearing a seatbelt, if you're driving down you still can have a bad accident, even though you're driving down a street that isn't very busy, doesn't have a whole lot of people on it. You can still have a bad accident. Something can happen. Someone can come through a stop sign. You just don't know. And so this is one of those things where it's a protection. The second piece of this, and the reason it's important that these assumptions are scary, is that the assumption is it's only about you and it's only about your risk. And when we're talking about a pandemic or we're talking about these diseases, that's not the assumption in the medical community. The important piece in the medical community is this is about our community. This is about all of us. So while you may be at low risk for getting seriously ill, you may have a grandparent or an elder or somebody who has, say, a heart transplant, kidney transplant. We have plenty of those folks in our community who's very vulnerable to this virus, and you're contracting the disease, may end up giving it to them. I think the third thing is that this has a profound impact on our schools and on our economy, in that when kids get COVID, they can't be in school. When workers get COVID, they can't be in school. When they've been exposed, they shouldn't be in school, because again, you run the risk of spreading this. So we've had lots of kids in school who've gotten sick with this and missed that 2, 3, 4, 5 days of completing a quarantine, whether it's over a weekend or not. So there's a lot of consequences to that. And so I really am concerned about this idea that it's just about me, it's just about my risk, and not acknowledging that what you do is risky for each other. The analogy I've used for folks, it's like choosing to drive rapidly through crosswalks, and not braking for pedestrians. You're going to miss most of them, but occasionally you might clip off somebody, but it's certainly not going to hurt you in the cars that we drive, but it certainly could hurt somebody else. And that's the concern.
Right. Right. And then the last question we had for this round was, can you give an assessment of what spring and summer might look like with what we'll be dealing with?
Yeah, so actually, I'm glad we're ending on a little more optimistic note. And I'll put in one more comment on vaccines that I forgot is boosters are really, really important. So this data only looks at people who've had the first 2 doses. It's not looking at those who've been boosted. And boosters are critically important. This is really a 3-shot vaccine, and I think as we've established. So 6 months after your second dose, you should be getting that 3rd dose, that booster, because that works really, really well at preventing disease rates and also decreasing hospitalization and death pretty dramatically. So boosters are really, really, really important. And just because you may have gotten COVID doesn't mean you shouldn't get a booster. You definitely should, because that just gives your immune system that extra training. It takes you from the somebody who's done an event and done a sport a bit to somebody who's really good at it. So,
well, yeah, and to that point, excuse me, to that point, I was reading a CDC article that was the doctor, I can't remember the name off the top of my head, but that was speaking that he was thinking even the terminology should maybe be changed, that he was considering it that you're shouldn't even be saying a booster, that you're not really fully vaccinated unless you've had the 3 shots, and that was a better way to perhaps frame it instead of the booster language. So that was,
yeah, whether you call it a booster, fully vaccinated, up to date, I really don't care. The bottom line is it's a 3-shot series. You need all 3. Right. And I think that's the critical message that the medical community and the experts have come up with over the past number of months. That's what really seems to be working. What does it mean for the future? I don't know. Probably boosters in the future at some point, don't know. Or an additional vaccination like we do with the flu shot. We'll certainly see what happens. And it depends too on what variants come up, if any further ones crop up, and they probably will. But bringing us back to kind of the question about summer. So what does it mean for summer? So I look at this and think about, okay, when can we all get rid of our masks indoors? And when can we say, irregardless of what our comfort level is, we're pretty comfortable dining indoors and things like that, because those are the things we all really want to get back to. So some of the experts I'm seeing look at case rates of being under 100 per week on an average. So in our case, because the county tracks it more day by day, so if we're under about 15 per day, I think at that point and again, I'm going to speak to people who are up to date on their vaccination. So the 2 doses and a booster, if it's the time. I think at that point we can be pretty comfortable if we're just going into a place and it's not very crowded, we're not wearing a mask. I think we can be reasonably comfortable that dining indoors, especially if the place is fairly careful about precautions, should be a little more comfortable. If it's jammed wall to wall, that's probably still a situation that's more risky. I think we can be pretty comfortable that flying is unlikely to convey a infection. You're unlikely to pick up an infection. I think if we drop further, so we're down below 8 per day. So right now we're at 59. So if we drop down below 8 per day, then I think if you're vaccinated, you can pretty much go back to life as normal. Now, if it's a super crowded type of thing, tons of people, you don't know their vaccine status, then I'd put the mask on. On the other hand, if you're going to a Broadway show and everyone's vaccinated because they've checked all the vaccination cards, and we're under that 8 per day, I think not wearing a mask makes perfect sense. So I think we're getting there. And I remind people we were there in June and July of last year. Mm-hmm. So this is not an unattainable goal. This is a goal we've attained in the past. I think we've got some work to do. Now, when is that going to happen? That's the key question everybody wants to know. I'm still leaning towards late spring, early fall, or early summer. I could be wrong on that, hopefully in the direction that it happens sooner, and it might. But I think we'll just have to see. Some places have showed a slower tailing off of that case rate. Other places have shown a pretty sharp drop like we're experiencing right now. But we don't know what's going to happen over the next few weeks, and that's just the unknown. So the point is, at this time, like I said, we're still in the forest. We're seeing the light, but there's still lots of trees. We still need to wear the masks. Yep. They work. They work. They work. They work. Despite all the noise that people make, they work. The other thing is people's wondering why the change in recommendation from cloth to a surgical or those N95 or 94 masks. They simply work better, and there's a lot of them available now. Those are the 2 key messages there. They work better. There's a lot more available, and Omicron is much more transmissible. So you put those factors together, and that makes perfect sense as to why we should have a change to use the best technology available.
Excellent. Well, I thank you again, Dr. McGinnis, and for sharing your expertise and the library trying to provide these information updates to the public and to our patrons. And hopefully we can have you back again as we get into the late spring, early summer, and maybe get some more of that good news like you were talking about. Hopefully we're finding ourselves in a better place for public events and work and school and all of that, and getting a little bit back to the way things looked before the pandemic.
Yeah, I think it really, I'm looking forward to that. Hopefully we can come back and have a little celebration when this thing calms back down. We had a little one in June and July, and then we kind of got caught by Delta. And that might happen again. We don't know, but we'll take what we can get. So if you haven't gotten your booster, get your booster. If you haven't been vaccinated, please, please, please get vaccinated. If you're not sure, please talk with your physician or other trusted healthcare authority about this, because they work and they're really safe.
Excellent. Thank you again, Dr. McGinnis. Appreciate it.
Yeah. Take care, Chris.
Thank you.